include hairdressers, and look at them again as to whether they belong in either a phase 3 or a phase 4. We did a lot of work on that today. We'll finalise that work next week and give advice to government that'll make, who we expect will be in a position to make decisions in relation to that advice towards the end of next week.
But you're not opposed to it, is what you're saying tonight?
I'm saying it'll be part of the advice we give to government.
Okay.
Yeah.
I ask you this every week. Any update on weddings? What constitutes a small wedding? Have we any guidance in relation to that for brides and grooms?
Nothing specific that we're going to say today, but we think that some of the guidance and advice that we're giving in relation to phasing will have relevance and application to a variety of different cultural activities, including weddings, for the remaining phases that we have and beyond that point. And as I say, we'll set all that out in guidance and advice that we'll finalise, I hope, next Thursday. And in anticipation of government meeting to decide, government will decide, make its own decisions in relation to this. We expect to finalise that advice next week.
So it's fair to say by next Thursday we should know when hairdressers will reopen and what size weddings can be?
No, it's fair to say we'll be in a position to advise government next Thursday.
Okay, but we might get some more clarity.
Government will make its own decision about when to communicate that advice.
Okay, excellent. Thank you very much.
Okay.
Hi, Tony. Excuse me, Shane Beattie from News Talk. On your press release, you talk about the need for a national communications campaign around the use of face masks, of face coverings. Is that an admission from NEFIT that you got the messaging wrong about face masks with the public?
No, but it's a recognition that we can do more. I think I said that exactly earlier this week as a society, and I think we need to give clear, consistent communication now with the assistance of the work that you do on our behalf, and with the planning and rollout of a communications campaign, which we hope will be in a position to commence in the early stages of next week, and that can help us with this particular guidance and advice. And what we've seen, even though we have not changed our position, we've not changed our advice, you haven't ever, since we adopted this advice, heard us give a different message in relation to that advice as to what we recommend to the public. It still is the case that we recommend face coverings in community settings for situations where physical distancing is a challenge. That's for use on public transport and in indoor settings, particularly retail settings. And that's continued to be our advice. And so that the advice hasn't changed. But we recognise that the level of compliance that we have, almost uniquely in comparison to all of the other advice and guidance that we have, is not where we would like it to be. And so we think we need to make an effort to try and step that up. We haven't moved to change, for example, to making it mandatory, as has been advocated by some people. We still think that we need to recognise the fact that there will be, for some individuals, a challenge in wearing face masks, and people who've got skin conditions and people in other situations may choose, and it may be appropriate for them to choose not to wear face masks, and that's why we think it should not be made mandatory. We think we can do a lot better through a consistent and coordinated communication campaign to support the advice that we've been given, which I stress has not changed. Yeah. But we need to see higher levels of compliance. But is that not part of the problem, is that people keep hearing you saying they're not mandatory and that's why they don't wear them? I don't believe that that's the problem, the fact that it isn't mandatory. I think that most of the advice and guidance that we have in place is not mandatory. We have no mandatory arrangement that tells people to wash their hands or tells people to appropriately look after their respiratory etiquette, or a range of other measures I could list. It's the buy-in on the part of the public, which we've seen all the way through this, and the trust and belief in the message that we've been issuing. That's what's got us through this. Yes, we've had reinforcing of some of the important advice that we have by way of regulations and statute, but in my view that has played a small part in the high levels of cooperation we've had across society. But we think we can do more in relation to this one, but we don't think making it mandatory is the answer. We think a more consistent and coordinated and more effective communication of that will help to get that done. Would you like to, you mentioned about public transport. Certainly anecdotal evidence from a lot of people is, you'll see people tweeting saying, I was the only one on the bus wearing a face covering. Is there more, would you like to see public transport bodies giving out face coverings when they enter onto public transport? Is there something that could be done in that sense where social distancing is difficult? I think what we have to look at is whatever measures can be taken that makes it as easy as possible for people to comply with the measures that we have in place. And we've seen it, and you're right to say in public transport, we can all see that. I mentioned the story myself of shopping in in the Swan Centre last Saturday afternoon, and as I was one of the few people wearing a face covering in that situation, I saw that for myself. We think in general terms retailers have done a terrific job in implementing and making arrangements to support the implementation of the guidance and advice around all aspects of this disease, as they have continued to provide services right from the start. I mean, many of the major retailers have not ever been closed. They've been providing essential services and access to retail for people, and they have done really good work. We think we can look forward to their cooperation in helping to remind the public, I think, of the importance of wearing face coverings in these kinds of settings, and perhaps it'll be no different for transportation organisations as well. But we'll be looking forward to that kind of cooperation as part of our campaign.
Just one final one for me. The Taoiseach telling the Dáil today he's confident that this country won't need to return to a sort of lockdown. I know you don't like using that word, but that we won't need to return to that sort of lockdown scenario again. He's confident of that. Do you share that confidence? Is it your view now that what we've done, we won't have to return to lockdown?
I think when we took the measures we took back in March, we knew a certain amount about the disease, but we know a lot more now. We've had the experience, not just in this country, but experiences in other countries to rely upon. And I think that even if we can't rule out the possibility of a resurgence of the disease, things not happening in the way that we anticipate or whatever, and finding ourselves having to respond at short notice to something we'd rather not have to respond to. And we have to always be ready for that, which is why we maintain the high level of vigilance and the consistent programme of testing and contact tracing for all of those reasons. And if that's to happen, what I think I could safely say is that we won't be using exactly the same blend of measures as might have been used previously. And we'll be looking to consider over the course of the next number of weeks what in fact might be those steps were we to find ourselves in that unfortunate situation. Not predicting that we would be there, but we don't think we'd need to do exactly the same things in exactly the same way. And that would reflect itself from the fact that we will have a population that will be, we hope, maintaining a very high level of compliance with public health advice. Many of the services and workplaces and other parts of society and the economy will be operating, if you like, to new standards and new arrangements where there are protections in place within those settings that limit the transmission of the virus. All that will be taken into account if we found ourselves in a situation of having to take measures to stop the resurgence of the disease. But we hope with high levels of behaviour we won't have to find ourselves in that situation.
Great.
Thanks, Shane.
Good evening. In the COVID committee today, there was further discussion on the 2 metre versus 1 metre, the merits of that debate with the official from the World Health Organization. Is it time now to look at that again? Is that something that might form part of the advice again next Thursday, the updated advice?
Well, we've never stopped looking at that or any of the measures that we recommend. Everything that we've said from the beginning in terms of measures is all subject to review based on changes in terms of either advice and guidance that could come from international bodies, research evidence that's published, or the experience either here or other countries. So we keep all of those things under review. And I think what we said last week is that we would give specific consideration, which we are doing, to the question of, during periods of low transmission, requirements around social distancing in the hospitality sector, and we're in the process of developing guidance in relation to that, which we hope will assist in the interpretation of those.
Is there any update on
particular
that guidance this week?
We hope to finalise that guidance in the near term and to make it available to the relevant sectors, and we're working on that this week.
Is that connected at all to something you mentioned last week about transmission by aerosol? Is that how you said it? Or you were looking at a different...
Yeah.
Is that with a view to that transmission would be safer to be at 1 metre with that type of transmission? Is that what's behind that?
No, not necessarily, but there is a relationship between the two, of course. I mean, there have been increasing reports in the literature of the possibility of aerosolised transmission, and we are aware that that's been a factor in relation to other viruses. So we thought that now is the right time for us to look more systematically at what the evidence says in relation to aerosolised transmission and what it is we might need to do in relation to that. But that's a separate piece of work. It's not directly connected to the piece of work around physical distancing and other public health measures in the hospitality sector.
And just again from the COVID committee today in the Oireachtas, discussion around the 14-day quarantine and air bridges being possibly a better solution, air bridges between countries that have the similar rates of transmission. What would your view of that be? Replacing the 14-day quarantine with those type of air bridges in the short term?
So, our position and advice in relation to it hasn't changed in relation to travel. We're asking people, as things stand, to avoid non-essential travel and making arrangements for non-essential travel outside of the country, either for people living here to go on holidays and have to come back. And we're looking at making arrangements to put our recommendations on a statutory footing. You're aware of that. We've said that consistently. That's been our advice. We are aware that work is happening through the ECDC and other organisations to look at how Europe might be able to safely recommence airline travel in the future. And no more than any other member state, we'll participate in that ongoing work.
Do you think we're an outlier in that situation?
No, I don't. I don't think we're an outlier. No.
Okay. And just on the figures there again, the number of deaths, it's the only one. Now it's small numbers, but it's the only one that increased slightly, 5 to 8. Is that a lag in reporting there? Is there the chart on the daily death figure? Or is there something behind that? You have no ICU admissions and a slight increase in deaths?
It's not. I mean, every death matters. So let me just start with condolences to that those small numbers of people involved. But again, it's not unexpected. There are some people who have had a long course in hospital or in intensive care that sadly has ended with them dying. And it's not unusual towards the end of an event like this to see some delayed deaths in essence. So sadly, it's the last indicator that you expect to see decline to zero.
Okay, thank you.
Thanks, Neil.
Rob O'Hanrahan, Joe Daly, can I just ask for the at-risk figures, the report from last Saturday, if we have them?
We gave those on Monday, didn't we?
On Monday, Rob, yes. There won't be
So they won't have changed from Monday. We do them on Saturday. We just happen to have them a little earlier in the week this week than we normally would. That's why I gave them on Monday. Yeah.
That's fine. Can I ask just about the number of active cases? Do we have an updated figure on that, and specifically how many active cases there are in the country, and then if we have the figure available for the active cases available in Dublin as well?
So what we know is approximately the number of cases diagnosed over the past couple of weeks. So I think, I don't have it right up to date, but it's about 250 last week odd, and something like 400 the week before. So any case diagnosed within the last 14 days would be regarded as active. And it's a very crude measure of activity. And of course, and when we talk about recovery figures as well, we're very conscious that it's a crude measure which describes recovery for the population as a whole. And it's not to say, and we know increasingly, that there's a proportion of people who go through this and unfortunately take a number of weeks or indeed months to fully recover. So we can give you the number of cases over the last 14 days. It's not really a very sensitive measure of disease activity for an individual.
And in terms of the number of cases that, using that crude measure, that have been specifically in the area of Dublin, do we have that figure available, or...?
I can get that figure for you. For the specific number of cases diagnosed in Dublin in the last 2 weeks, I can get that figure for you afterwards.
Thanks. And just finally for myself, just in regards to face masks, Dr. Hillam, why do you think compliance is low? If like you were saying, that we need a national communication strategy now to raise it, what do you think are there concerns around it, or are there people who just simply haven't gotten the message?
Yeah, perhaps it is that, like, what has, we think, been a clear and consistent advice hasn't been heard by people as a clear and consistent message. And if that's the case, we think a communication campaign can help to turn what is clear and consistent advice and remains unchanged into a clear and consistent message. There has been a lot of public comment in relation to this. You'll know this from a variety of sources, that there is, if you like, difference of opinion in relation to this, not just in this country, but in other countries. So guidance and advice from international bodies, guidance and advice in respective individual countries varies from one another, and there is variability. And that isn't necessarily inappropriate in the sense that there is, on a continuing basis, as you'd expect, debate. There isn't always going to be consensus around a scientific understanding. And without in any sense wishing to sound critical, many of the people who have commented on this are people without necessarily the appropriate skills or knowledge bases to... so we think the views of public health specialists, of virologists in particular, are not the only views, but we think these are important ones. And I think as part of our communications campaign, we need to hear those voices now most clearly, although there are a lot of voices on this particular subject.
And if the compliance doesn't rise in the next few weeks after the campaign to the levels that you would maybe want to achieve could we see mandatory wearing of face masks being brought in?
I think we are going to see an improvement in compliance. I'm going to express that hope, and I'm not going to start to predict that we're going to see mandatory in the base that we won't see an improvement in what we're experiencing. I think we have to leave room and latitude for the fact that, as I've said all along, there will be settings and occasions and individuals where face covering use doesn't happen. What we need to see is a much higher level of use of those. But if we set a standard of mandating something in some form of sanction in relation to the use, I think it would be inappropriate, either in terms of an interpretation of the clarity and certainty of the evidence, and in particular in terms of the fact that there are some individuals for whom this either won't or can't be appropriate at a point in time.
Thank you.
Thanks, Rob.
Sinead Crowley from RTE. Can I ask, has there been any update on the meat processing plant figures, particularly in the last 7 days?
We don't have an update over and above what we gave on Monday, which was that there had been, I think, an additional 43 cases in the week to Saturday night. And we'll have more figures this coming Monday. This current week, yeah.
And was there any discussion at NEFIT? Is there any other area that you are looking at as a group? I mean, I know you mentioned domestic situations or houses the last time. So you had nursing homes, meat processing plants, houses. Are there any other areas that are of particular concern?
I think you could see from Philip's slide there that so the numbers across all settings at the moment are thankfully low. But I think in particular we are seeing that the disease has moved in overall terms back into private houses, and so I guess we have moved from a situation where we were particularly concerned about other settings to a situation where we really want to emphasise the message again to individuals about all, and you can see it on the yellow slide that we have in general, that it's all increasingly now it's about individual measures, whether it's hygiene, whether it's respiratory etiquette, whether it's wearing a mask in appropriate or face coverings in appropriate settings. So yes, as the weeks have gone on there, you can see that increasingly we're focused on the individual behaviours.
And are you worried that given that people are now meeting up and they're allowed the 6 people in other houses, are you worried that this is going to go up, or would you have any advice for people?
Well, I think we've seen that over the past number of weeks that all of the parameters have continued to improve despite the easing of measures, and so that gives us strong reassurance that people have taken the messages on board, and that hopefully some of the measures that we've been encouraging on a voluntary basis and that people are clearly complying with over many months are hopefully becoming habits. And that seems to be translating both here and internationally into a situation where we're not seeing a significant upsurge in cases as measures are eased, and hopefully that will continue.
Okay, thank you. And we had asked last week about other ethnic backgrounds or research being done into those. Has that been done yet, or would that be?
So the HSE has started to collect that data and analyse that data. It will probably be a number of weeks before we have significant data to share on that, but they have started that process, yeah.
Okay. Thank you very much.
Sinead. Michelle.
Good evening, Michelle Hennessy from the Journal.ie. Just to come back to the discussion around face coverings, obviously members of the public have been hearing, even after the guidance was issued from experts, that the evidence around cloth face coverings isn't really that strong, and also that improper use could actually put people more at risk. Do you think that that fed into the confusion among the public, and how do you think the message can be cleared up now?
So, well, look, we think clear and consistent messaging support from the relevant organisations that we think will be important in the advice that we have, like retail and public transport organisations and so on. So that will all form part of our campaign, and we're working on the development of that. I think it's fair to say that there has been, the extent of evidence in relation to those things is limited, and that reflects the fact that not a lot of work is done to establish the transmission, if you like, in community settings. So most work that's done in the literature in relation to the use of these kinds of physical barriers tends to be done in healthcare settings. It tends to involve healthcare staff, and it tends to involve medical grade PPE. And in this case, in this form of PPE, we're talking about face coverings. I suppose what gives us cause for concern is not the right word, but balance, I guess, is that while all of our conversation is now in relation to face coverings, there's a lot of attention on this, it doesn't reflect the fact that an important mode of transmission of this through hand contact is also an important part of people's public health advice and a behaviour that needs to be maintained. And so when we say that there is not evidence of something, it's not the same as saying that it wouldn't work. So we think on the basis of emerging evidence such as it is, which is giving assurance that face coverings can play an important role in terms of reducing transmission. We also think that on a precautionary basis, it's a reasonable step for us to take at this moment in time on the basis of, and so we think for both of those reasons, we should be advising, and that's the reason we changed our advice to incorporate the use of those face coverings in those community settings. And we did it ahead of many countries and many organisations back in the early part of May. But we know, unlike all of the other advice we have in place, maybe the compliance hasn't been where we'd like it to be, and we think we now need to redouble our efforts to improve that and to see where that gets us.
Okay. We're hearing some anecdotal reports in relation to dentists charging as much as €20 extra to help cover the cost of PPE for their staff. Do you think it's appropriate to pass those kinds of costs on to patients?
I'm not aware of that now, and so I don't want to be saying anything that represents a view based on an understanding or knowledge of that. We think it's appropriate that people use PPE. We think it's appropriate that the use of that PPE reflects the appropriate clinical circumstances in which it's needed. But I don't want to make a comment on that might sound critical of the activities of any one individual. I think it's important in a general sense that across society and across the delivery of healthcare, we have a mix in this country of public and private provision. And it isn't always necessary or appropriate for the state to be the sole provider of financial support for the use of things that are recommended across the healthcare system. I would make that statement in a general sense, but I don't want you to take that as an implied criticism of dentists around something that I wasn't aware of until you raised it.
Okay. Just one last one in relation to a breakdown of figures. Do you have any kind of breakdown in relation to gender in terms of cases and deaths in nursing homes?
Yeah. I don't have that at the moment, Michelle, but I'm sure we can easily get that. So
Okay.
a gender breakdown of cases and mortality in
nursing homes.
Yeah, we can get that for you. Yeah. You have it here.
Yeah.
Yeah. Owen.
So in terms of cases in nursing homes, 67% and 33% of the cases have been in women and men, respectively.
Okay.
And then in terms of deaths, in nursing homes, 57% and 43% of deaths have been in women and men, respectively. And I've seen some commentary today in relation to the fact that approximately 50-50 in terms of deaths in Ireland. I think, and there's a question as to whether that's higher for women versus women in other jurisdictions. But I think the key metric in relation to that is the case fatality rate. And so the case fatality rate for women in Ireland is 6% from this disease, whereas it's 8% for men. So hopefully that will allay that particular concern that there's something out with it. I think the rates that we're seeing here reflect the pattern of the disease in Ireland and where we've experienced it.
Okay, thank you.
Paul.
Paul Cullen, the Irish Times. Just on the issue of the 2 metres versus 1 metre, you mentioned the hospitality sector in that context. Are you also going to consider schools? This was an issue that the Taoiseach referred to in the Dáil today. He referred to the 2 metre versus one thing, and then he mentioned schools in that context. Just wondering if you had any plans to extend your considerations to the school, to the educational setting.
So, I mean, look, as a general statement, I'll say that like our advice and guidance around 2 metres still stands. We think that 2 metre physical distancing is appropriate and carries with it much lower risk of transmission than 1 metre. And that's our advice in relation to that. In a general sense, you'll see ECDC are publishing advice on a continuing basis. They published healthcare specific advice yesterday or the day before, and we expect them to publish very shortly, new and 11th, I think it is, risk assessment report, and I think will reinforce the value in general in public settings of that further 2 metre. In terms of education, we're continuing to engage, in particular through our colleagues in the HPSC, in supporting the education sector in re-establishing some of their services. We set our view and advice out last week that for the commencement of phase 2, that we didn't see a continuing public health reason assuming the implementation of public health advice for education services to not resume, that they could resume on the assumption that the advice that we have in place was complied with. But we're trying to work with them to provide more guidance and advice to them in relation to that, and to support them in relation to that work.
But you've referred to this hospitality sector specifically in relation to this issue.
I did.
Are you giving a similar consideration to the educational sector?
So what we said, we would set out guidance and advice on the interpretation of physical distancing in the hospitality sector for periods of low transmission. So we're not doing an equivalent piece of guidance and advice for education, but we are doing more general education guidance and advice through our work with the HPSC, and we look at all of the measures from a public health point of view that are important. I mean, the hospitality sector obviously is very, and I know you're not drawing a comparison, it's very different. The length of day of school day is very different to the length of time that somebody spends in the hospitality sector and so on.
And I suppose the school day doesn't arise till the autumn anyway. For most.
Pardon me?
The resumption of school days doesn't arise till the autumn anyway.
Well, those are the questions that the Department of Education are looking at, about what they can resume and when, and what arrangements they need to put in place. And as I say, we stand ready to support them in the work they're doing on that.
I was wondering, do you have, probably Ronan, do you have any figures on the length of time spent in ICU, the range? Because in other countries, even before we came here, we knew that some people are spending an awfully long time in ICU. Do you have any figures of that now or at some other time?
I don't have the figures to hand tonight, but in general terms, you're right that what we're seeing with this disease is a prolonged length of hospitalisation versus what we would expect, for example, with seasonal influenza, prolonged lengths of stay in ICU, and on Monday I can bring along the specific figures.
Liam might supplement that a little from the HSE. Liam.
Thank you, Tony. We're seeing an average length of stay in ICU of about 14 days. Don't have information on the distribution, but we can get that. But we know that we have some very long lengths of stay beyond 60 days in ICU. And I think the data that Philip showed earlier is demonstrating that there's quite a long tail in treating people in ICU, and that reflects the nature of this condition.
Very good. And just finally, we're based on the figures for the last week of new cases, we are quite close, relatively close to eliminating the disease, are we not? Or do you think that there are other cases or groups of cases out there, as there were in the early part of this whole saga? You know, so, and then the follow-up to that is, if we are that close to it, is there not a case for, in public health terms at least, saying, hold on, everything we're doing is right now, and just hold on for another week or two and see if we can actually crush the curve, as the phrase goes?
So we think, and so that came up in the earlier part of this week, and I described maybe some of the commentary, and we were aware obviously of the communication from a large group of scientists in relation to that, and I think we were pointing to the fact that we think there may be language differences as opposed to strategic differences in our approach. Our intention and objective is exactly the same. We gave specific consideration, in fact, to that piece of communication, that open letter at the National Public Health Emergency Team today, to see if there was something in that we might identify as an additional measure we thought we needed to take, and I think we were broadly satisfied that there wasn't. And we think that, you know, in terms of the numbers, we will go as low as we possibly can. We're down now we've had a number of days already this week where the number of cases is less than 10. In broad terms, we don't think that there are significant clusters of infection out there unidentified. But if there are things happening in terms of transmission of this disease that we don't know about, which we don't think is the case, we think we have the testing, sampling, public communication, contact tracing, etc., arranged into place to allow us to identify and respond to that appropriately. Philip, is there anything, did you want to add to that?
Yeah, absolutely. The absolutist notion of elimination, that you can come to a point where the virus is utterly eliminated from the island and there is no possibility that it will recur or enter or re-emerge, is an attractive sounding strategy, but not really a practical or implementable one. The situation that we're in now, where we have almost zero cases occurring day by day, is an effective strategy, and one that integrates well with the other countries in Europe, with whom over time we want to increase our level of exchange and discourse, not decrease.
Okay. And sorry, just when do you meet next, and what's on the agenda for whenever you're meeting next?
So we meet next Thursday, and in broad terms, the usual agenda, if I can describe it as such, the particular focus next week is going to be on finalising our advice in relation to the rephasing that I described, the remaining measures over the 3 phases that are in our previous advice and that are reflected in the government plan into the remaining 2 phases. We'll keep if the EPI data, including the data in relation to meat plants, under review. We'll keep the question of testing and where we should be focusing our testing under review. Those are the main measures that at this moment in time we want to give consideration to next week. Thanks, Paul.
Dr. Glynn, you had just mentioned in last night's press release about the recovery rate that it was at 92%, but you also spoke about some of the more long-term effects of the disease. Could you speak to that and just tell us a bit more about that?
Sure. So clearly this is, in relative terms, a very new disease and one that we're still learning about. Essentially, we're just over 100 days since the first case that we've had in this country and in most countries internationally. Clearly, for anyone who is admitted to an intensive care unit, for regardless of what the underlying condition is, it can take a number of weeks and months for them to recover and get back to their baseline level of health and fitness. And we've had over 400 cases. But I think anecdotally and increasingly through case reports, we're hearing and seeing of an increasing number of people who've had this disease and maybe not even been hospitalised, but who are having prolonged side effects, or it's taken them a prolonged period to recover, to get their energy levels back. We're hearing of some people having difficulties with exercise tolerance over a prolonged period. It's difficult to say much more than that at this point because for many of these people, they're still within the first 6 weeks, 2 months of their illness. And so it's not necessarily unusual that it takes a while to recover after a significant respiratory illness. But it's certainly something that we'll need to monitor over time. I guess my point was last night is that whilst we speak about 92% having recovered, we have to be important that we're not playing down the fact that within that 92%, there are many people who still haven't got back to feeling how they felt before they had this disease. And I guess as part of that, it's a message to people that just because perhaps you're younger or perhaps because you don't perceive yourself as someone who might suffer the most significant effects of this disease if you are to become infected, it doesn't necessarily mean you shouldn't still be doing all in your power to ensure that you don't get this disease, that people in your family, your friends don't get this disease, because the ultimate outcome for you or any one of your family or friends is unknown. So follow all of the measures on the slide and keep yourself and your loved ones protected.
And so with that said, would you have any advice for people then who, as you say, are in that kind of 6 weeks to 2 months post sort of the immediate illness? Is there any guidance for them in terms of maybe taking it a bit easier? Don't be forcing yourself to get back out for your runs and things like that. Is there any practical advice for people who are in recovery?
It's difficult to give advice in general terms like that, but as for any illness, as you recover, if you've got questions, if you've got concerns, you talk to your GP in the first instance, and they'll be best placed to advise you. They'll know your medical history better than anybody else.
Just really quickly, finally, I know you're going to wrap me up now. I had a question today from somebody, and I don't know if this has come up before. It's about the islands. They're wondering, is there any information on when the islands can reopen? Has there been any guidance? I don't know if there has. I'm just wondering if you had anything in relation to that.
This was part of the set of measures that were previously communicated, and we'll have a position on all of that towards the end of next week by way of advice to government. So that's
part of next week. Yeah. Okay. Great. Thank you.
Yeah. Thanks, Sarah.